Yeah, so welcome everyone to our June community meeting. I am very excited about our presentation today as we learn more about PoNS treatment, what it is, and how it uses the tongue as a superhighway to the brain. We are so grateful to PoNS and Helios Medical Technologies for not only donating their time to speak with us today, but also for supporting BIST as a silver sponsor. Their sponsorship has been essential in helping us continue to offer our programs and webinars throughout the pandemic. We are thankful for their ongoing assistance. So again, thank you to all the wonderful people at PoNS. Before we get a chance to meet our presenters this afternoon, I do want to make sure everyone is comfortable with the platform. I have no doubt our members are Zoom experts at this point, but I do see many new names, which is amazing, and I'm so happy you could join us. So for the uninitiated and unfamiliar with Zoom, let's just take a minute to get ourselves oriented. This works best if you begin to move your cursor around the screen for a moment or two. You should find a dark gray bar appears at the bottom of your monitor. There's two functions I want to draw your attention to, and they look like little buttons. One says questions and answers or Q&A, and the other says chat. Please feel free to use the chat throughout the presentation. I will be monitoring it in the background, but those responses will not make their way to the presenters. If you do have a question for the presenters, please use the other function, the Q&A. We will have an opportunity following the presentation to ask Dr. Kovelman some questions. So we will make sure those get to him, but it works best if they're all sort of in one spot so that we do get to them all. I do also want to mention that we are recording this webinar. So the presentation will be available to you very soon on our YouTube channel. If you're planning on taking notes or just need a reminder of what was said today, please check our website and YouTube tomorrow for the video. But to introduce our presenters, I would like to bring everyone our Executive Director, Melissa Vigar.
Thank you. So, and I just want to take a minute to echo what Ryan said. We certainly very much appreciate the folks from PoNS being with us today, and especially appreciate their sponsorship of BIST. As Ryan said, we certainly can't do the work that we do without our sponsors. So just another thank you. So without further ado, I will introduce both our speakers today. So Dr. Harry Kovelman, he's the Vice President of Medical Affairs at Helios Medical Technologies, Inc., which is the company that's licensed for PoNS. He received his Doctor of Medicine degree at University of Maryland, University Hospital in Baltimore, Maryland. In his current role with Helios, Dr. Kovelman focuses on treatments and educational initiatives to help patients affected by neurological symptoms caused by disease or trauma. With over 25 years of experience building, leading, and developing medical affairs teams, his passions lies in managing the evolving needs of organizations. Can't hear me? Ryan, can you hear me?
I can hear you, Melissa.
Okay.
I can't hear anything.
Oh. Dr. Kovelman can't hear anything. Is the volume all the way up on your computer? I don't know. I'm saying it because he can't hear. Do you want to type, Brian, in the chat box maybe?
Sure, yeah. Dr. Kovelman, I'll message you in the chat.
I'm sorry he can't hear me saying all these great things about him, but I'm going to keep saying it for our audience. Beth, can you hear me okay?
I can hear you, yes.
Okay. Okay, so I'll continue singing his praises. So with over 25 years of experience building, leading, and developing medical affairs teams, his passion lies in managing the evolving needs of organizations in the pharmaceutical and medical device industries. Today, he's going to discuss the science behind the PoNS device and is happy to answer any questions you might have. So like we mentioned, Ryan will monitor the chat box and Dr. Kovelman is graciously going to answer those questions for us. We are also very grateful to have Beth Foster here. Beth, do you want to give a little hello?
Hello.
So Beth is a former PoNS patient. She completed her treatment in 2019 at the Advantage for Athletes Clinic in Markham, Ontario. So she's part of our team here. Prior to starting the treatment, Beth had been suffering from chronic balance deficit due to a mild to moderate traumatic brain injury. She'll be sharing her mmTBI journey with us and how PoNS has played an important role in her recovery. So I'll leave it to the PoNS team now to take it away. Dr. Kovelman, can you hear us now?
Yeah, all good now.
You missed me singing your praises, but
That's okay. I believe you.
you can watch it after.
Okay, thank you. So welcome everybody. I'll do my best to move along at a pace. And again, if there's any questions, please feel free to send them in and we will answer the questions all at the end. So if you can move to the next slide. So as part of the discussion today, I am obligated to let you know that PoNS is a licensed Class 2 medical device in Canada. PoNS is only cleared in Canada. It is an investigational device under review, and it's not commercially available in the United States, the EU, or Australia. So that's part of our regulatory obligation. And now we'll move into the rest of the presentation. So to my surprise, and I think to others, when you look at mild or moderate TBI and you say to yourself, well, really, how many people are actually living with a chronic balance deficit after a mild or moderate TBI? The literature is really scarce for this information. In matter of fact, most of the information that we have available to us is on severe TBI. So we had to do a lot of literature searching in order to find this answer. And to my surprise, it's really significant. There's about 350,000 people living in Canada with a chronic balance deficit or, you know, the inability to walk or have a gait problem after their TBI. And we believe that the literature shows us, it's pretty conclusive, that approximately 13,000 cases are added to that 350,000 number that is already at our base. But what's even more informative to me, and probably not to you all, is that there was a great study that looked at the Hunt group, actually at St. Michael's. They looked at the annual cost of mild TBI to the Ontario healthcare system. These are people who had a concussion, went to a specialty clinic, and they followed them for a 10-month period before they got back into their clinic, okay? And during that time frame, they recorded the number of visits they had and where those visits went to. And on average, each one of them had about 33 visits. But what really clarified the thought process here, or substantiated the thought process, was the bulk of those 33 visits, went to physical therapists for balance and gait problems and to psychologists, which I would imagine would to be to help with the coping or a coping mechanism, right? Because if you think about it, most of the people who have these balance deficit withdraw from society a little. They're not able to possibly, you know, work with their grandchildren, walk outside without falling over, and that, you know, they don't like going out into society, so they need help. And when you took that number out to the population just in Ontario that have a mild concussion, it exceeded $110 million of the burden of the disease of just a concussion. So it's a really big problem, and I'm sure you all understand this. Next, please. So what does the patient journey look like? I think most of you are familiar with this, right? You get a diagnosis of a concussion or a mild or moderate TBI. You might go in to see a care team, you might not. Those symptoms usually persist for somewhere between 3 to 6 months, maybe before you do get in. During that time, maybe a therapist, a physical therapist, is suggested for you to have therapy. You undergo that therapy for maybe through month 6 through month 9 or even longer. And then, oh my God, what happens? It's not getting any better. And then if it's available, you may get a referral to a vestibular therapist, which are few and far between. And then if that doesn't work, you are now a year down the road. You consistently have these problems. I think Beth is going to speak to that today, or something similar to that journey. And this is what I hear from a lot of the patients who get treated. Everybody basically has the same story. And it's a problem, right? As a matter of fact, most of the physicians that I speak to wish we could recognize this earlier and, you know, have more specifics or more data on those patients that are going to go on to have these problems. So I hope this patient journey makes sense to you. Next. So how does the PoNS work, right? What's so different about this? And if you remember the title, A Superhighway to the Brain. So if you think about it, your tongue is very, very sensitive. You can actually feel you know, when you have a seed stuck or something, you can feel it on the end of your tongue. And the tongue has a lot of cranial nerves that deliver messaging to it and take it from it. And there are two nerves, the trigeminal facial, that come to the anterior portion or the surface of the tongue. And those two nerves are the trigeminal facial nerve. And what the PoNS does is it provides a gentle stimulation to the surface of the tongue, and it creates a cascade of messaging, similar to if you're playing telephone. And these cranial nerves go right up, like a superhighway, right into the midbrain pons cerebellum, which is the area of movement and motor control. And it's believed that it creates a new neural network, thereby creating this area in the brains, wherever the deficit is, to now process all this information that might have not have been processed before, despite getting all the physical therapy. So it's been proven in the literature that when you prime the brain or get it ready to receive a signal, and you do that in conjunction or symbiotically with a targeted therapeutic activity like balance training, like gait training, whatever that activity is, that you will have a better response. And for those of you who have not utilized it or don't know what the PoNS feel like, and you're saying to yourself, oh my God, you're gonna put electrical stimulation on my tongue. So it's actually a gentler stimulation than you would get with than a TENS unit. It feels like, depending on your age, it feels either like champagne bubbles or pop rocks. And it delivers about 25 million pulses per every 20-minute session that you are having. And you use the device while you are doing the physical therapy. And I will show you that in further slides. Next. So how did we know, what part of the tongue to stimulate, right? Did we, just put electrodes on the tongue and, trial and error? Well, it was a little more sophisticated than that. We actually did a heat mapping of the tongue to show the more sensitive areas. And as you can see, it has, 144 gold-plated electrodes. They go in range. There's 9 different sectors, and each sector has 16 channels, and all the number 1s in one sector go off, all the number 2s then go off, all the number 3s, and it's a sequential pattern. And because the front of your tongue, the tip, is more sensitive, it actually, in order for the sensation to feel the same from front to back, the sensation goes accordingly. So you'll get 100% at one area of the tongue, 75% at the other, 60% at the other, and then 40% in another part. So it feels like an even stimulus that's being generated. Next. So what is the device intended to use? So when you apply for your clearance with Health Canada, you have to give what's called an intended use statement, or how will your device or pharmaceutical be used. In our case, Health Canada cleared the device for the following use. The device is intended for use as a short-term treatment we define that treatment as 14 weeks of chronic balance deficit due to mild or to moderate traumatic brain injury, and again, is to be used in conjunction with physical therapy. Remember, I can't stress this enough. The therapy and the device have to live symbiotically. You cannot do one without the other and expect the same outcomes. You can't use the device before you do the physical therapy. You can't use the device after you do the physical therapy. You have to use the device while you're doing the targeted activity or the physical therapy. And in MS, the device is intended for use as a short-term treatment of gait due to mild and moderate symptoms from MS, and is to be used again in conjunction with physical therapy. So what about the data, right? What does the data look like? So I want to go over this with you. I'm going to keep it very high, and if there's any questions, I can dive into it deeper. So there have been 2 articles published on TBI, both in well-respected peer-reviewed journals. One is the Archives of Rehabilitation Research and Clinical Translation. The other one is the Journal of Neuromodulation. And to make a long story short, what the data has shown is that approximately 74% of our patients will respond to the treatment. Well, Harry, what does that mean? Well, what it means is we used the SOT, which is the Sensory Organization Test, as a measure of a patient responding. And think of it similar to blood pressure, right? Blood pressure is 120/80. And if you have a good response to a drug, maybe your blood pressure will drop to 120/80 if you begin at 120/100. In our data, we considered a responder to be somebody who gained 15 points or more on the SOT. The SOT is a phone booth that you get in. It moves around you, moves the floor, you close your eyes or open your eyes, and it gives you an overall score, 70 or more being normal, and you adjust it for your age, okay? In most trials in the literature, if you gain 8 points or more, it's considered to be a meaningful clinical difference, which to the therapist means it made a difference, and to the patient, excuse me, it made a difference in your activities of daily living. We used a responder rate of 15, almost twice what we consider a meaningful clinical change. And in our data, 74% of the people responded. The average patient score that came into our study on the SOT was 40. 40. Most of the people left with a score of anywhere between 66 and 72. Now remember, one of the ideas behind the combination of the therapy is the literature wants you to achieve what we call a neuroplastic effect, or effect that will take place that won't drop off. You won't lose what you gain. So what we did in our long-term treatment trial is after the 14 weeks, we took away the treatment. Every patient of the 43 people could go about their activities of daily living, and they didn't have to use a device. They didn't have to do their physical therapy. They just lived their lives. And what we found out is after the 12 weeks, when we removed the stimulus, whether it's the therapy or the treatment program and the device, most of those people maintained their gains or even gained more, suggesting that the brain is having a neuroplastic effect, that these changes are not temporary, but more along the permanent line. And I hope that makes sense to everyone. I could always answer questions or not. Next. So what does the PoNS treatment look like? It's a 14-week treatment. So it is a commitment. It's a commitment to do the therapy, and I'm sure Beth will address that. How does it happen? So there's 2 phases to it. Phase 1, we consider in clinic and at home. It's 5 days a week that you are coming in. Weeks 3 through 14, it's 5 days at home and 1 day a week coming into the clinic so the therapist can assess you and make progressions.
Hi, Dr. Kovelman. I'm sorry to interrupt you. I think we lost your connection very briefly for a minute or two there. I wonder if it's okay if you just maybe back up about a minute into your explanation.
Yeah, so I'm sorry, please forgive me. I'm actually right next to the signal, so I can make sure that.
Okay, yeah, thank you for your understanding.
Okay, so the treatment. So what's involved in the treatment? The treatment is 14-week program, right? It is a commitment, and I'm sure Beth will speak to that. It's broken down into 2 phases. Phase 1 is weeks 1 and 2, which is 5 days a week in the clinic and at home. And part of that is in any sound-based physical therapy program, you have to get the foundation of the program correct, and that's why you are spending so much time in the clinic. And then phase 2, which is weeks 3 through 14, you are now doing most of your therapy at home, and then you're coming into the clinic to be assessed by the physical therapist to progress you accordingly and challenge you. There are assessments that are done at baseline when you enter the program, assessments done at week 4, assessments done at week 8, so you can see your progression and share that with your neurologist or any other HCP. And then there's a final assessment that's done at 14 weeks. Ryan, was that better? Was everybody able to hear that?
That was excellent, thank you.
Okay, next. So what does it look like? Again, this is something that Beth is gonna delve into, having the experience. I'm gonna summarize it. Once again, I'm gonna say it's a commitment, right? There's a morning session and an afternoon session. The morning session consists of a warm-up. Then you're doing your balance training with the PoNS device on your tongue for 20 minutes. A gait training with the device on your tongue. And then you do what's called a back session of breathing in and awareness or mindful meditation for 20 minutes that you go into a room, it's quiet. Mindfulness training has been shown to be very positive in the physical therapy literature. And then you have a break for 3 to 4 hours. You got to let your body rest. And then you have an afternoon session where it's basically somewhat similar. And then you have an evening session where you're doing the breathing and awareness again. Okay, so again, I want to reinforce that this is a commitment in order to obtain the most positive effects that you can have from this treatment program. Next. So for the therapists out there and for the patients, this is a sample report that the therapist can load down to their computer, and it actually tells them the overall picture and the last 30 days activity. Because one thing we know in our studies is that patients are highly compliant. And if you're highly compliant and you're a responder, right, there's a reason why. It's because you're using the device at the same time you're doing your therapy. And the device is a smart device. It actually can record if you're wearing it. So if you're coming in and the therapist says, Mrs. Smith, you're not making the same gains that you did in week 1, it shows me on my report that you're not doing your morning and afternoon gait training sessions. Somehow, some way, 1 and 1 equals 2. If you're doing the program and you're a responder, you're wearing the device, and it'll show in the progress report. There's nothing magical about it, but I just want everybody to understand that this is really good for the therapist to download and speak to their patient and possibly even put in the chart. Next. So what are the contraindications, right? Part of being a vice president of medical affairs, besides being a physician, is there's, you know, no panacea about the device. There's the good, the bad, and there's contraindications, and there's precautions. So very similar to other electrical stimulation devices, there's precaution for those who've had, you know, a bad response to TENS unit. It also should be not used in patients who are or have an active or suspected malignant tumor. There's suggestion that the electrical stim can grow the tumor more. If you have a recent bleeding or open wound, we won't want you to use the PoNS. And if you lack normal sensation, right? If you're just, you know, if you're a big smoker and you can't feel anything on your tongue, or you have an abnormal sensation, we certainly don't want you to be utilizing the device, because if you can't feel the pop rocks, it's going to be difficult. We are not, have not been tested under the age of 18 or people who are pregnant. So you can't use it if you're either one of those. And in addition, if you have any kind of allergy or sensitivity to nickel, gold, or copper, because of the way the plates are finished, we don't suggest that you utilize the device. Next. So here are the use with caution. Just like anything else, you need to use it with caution if you have a cardiac pacemaker, a defibrillator, DBS, a vagal nerve stimulator, a sacral nerve stimulator, a cochlear implant. It should be discussed with your treating physician. Metal in the mouth, pierces, braces, retainers, any kind of orthodontic appliance. If you have a history of seizure disorders, or if you have epilepsy. Remember, this is not a contraindication. It's a use with caution, and discuss it with your therapist and your physician. So what are the next steps, right? From the medical side of the organization, we are absolutely committed to advancing the science of neuroplasticity, or the brain's ability to make itself better. We are working with clinical and academic partners to look at studies and to advance the understanding of the PoNS treatment. You can keep an eye out for that. Anything that we're going to do, we will probably post on ponstreatment.ca. And how do you know where to find the clinic, right? So again, on PoNS Treatment CA, there are currently 7 authorized PoNS clinics across Canada, 9 authorized clinics in the GTA. And again, you can log on to the website and find the treating center. So I think that's it for me. Thank you for your time. I hope I was able to cover that in the appropriate amount of time.
Thank you, Dr. Kovelman. Before we move on to questions and answers, we're going to hear a little bit from Beth Foster. Beth, I believe your mic should be working. Can you hear me?
Yes, I can hear.
Awesome.
I just have the screen in my way of my words again. Maybe if I minimize that. There, I've got them in front of me now. Good.
Excellent. Okay.
I'm a learner at this. So I'm to begin by saying thanks, Ryan. I'm really honored to join you all today and be able to share my story. In my experience, the feeling of isolation that came along with my brain injury was one of the most difficult parts. You're very much alone, so it's really nice to be able to talk to you all today. My story begins 5 years ago with a car accident, and it changed my life in an instant. I was always this someone who was a goer-doer, as I described it, but all that abruptly changed when I got rear-ended at a stoplight, or a red light rather. And at that moment, I really didn't know how hard my journey was going to be. I felt this hot, searing, knife-like pain cutting a path from the back of my neck here, right through to the front of my head. And as fast as that pain hit, with the it was gone. But I'll tell you, to this day, that feeling, it burns in my memory. I won't forget that. But the doctor told me I had suffered a traumatic brain injury. I had soft tissue damage in my shoulder and whiplash in my neck. And my first thought was, when I got hit, honestly, was, what just happened? And boy, am I going to have a stiff neck tomorrow. I was totally clueless to the misery I was about to endure. Following the accident, I experienced nausea, extreme headaches, leg pain, body aches, and more. It was really more than I had expected. I would sleep all the time, but would wake up feeling like I hadn't slept at all. I really couldn't handle hearing people talk, background noise. I also experienced a lot of blurred vision. And you know, the best I could do, really the only thing I could do, was just stay quiet and still. And at one point, my doctor told me, you know, this is going to be a long, slow process. Well, the days turned into weeks, and the weeks into months. And I did notice that some of my symptoms, they lessened somewhat, but my balance and my walking issues, however, did not let up. Everything, my walk, my ability was just gone. I could no longer attend family things like the car shows, concerts I liked, or my church activities. I couldn't drive myself or garden. Even walking outside was a challenge for me. I felt unsteady, and I'd walk off to the side. And I found when I had trouble balancing, it often led back to that nauseous. So walking and talking with a friend was completely out of the question. I couldn't no longer play with my grandkids, and being there for my son and my spouse was very much harder thing to do. I found myself enduring life, not enjoying it at all. So I went from this goer-doer person to a life literally locked within my walls of my home. I eventually did get connected with the trauma center. They had this whole body and mind approach to rehabilitation. And they had heard about the PoNS device and its success. So they referred me to Dr. Ryan Scott at the Advantage for Athletes. It's an authorized PoNS treatment clinic. And even if it meant for me a minimal improvement, it was enough for me to say, I'll give it a try. When I went for my assessment at A4A with Dr. Scott, he asked me what I expected to get out of this treatment, and was I in it for the long haul? And my response was, well, even if I get an inch of something is better than none at all. But I didn't know what that inch would be, but I soon was to find out. The day I started, my husband, he's not a very verbal person, very quiet. He tucked in a note in my bag, which I found when I got to the clinic, and it said, "You will do this." So I started on Monday, July 22nd, 2019. And within the first 2 weeks, I can tell you, I gained much more than that inch of improvement. I mean, in those first 5 days of starting treatment, I started to feel tingling in the back of my head. I was improving on the treadmill. I was no longer feeling that nauseousness due to my imbalance. My ability to maneuver on the treadmill, so amazing. Excuse me. Just to watch it unfold, just amazing. I went from this one-sided bear walk that I didn't even realize I walked one-sided, which is like this way, arm and leg together, at a very slow pace, then to a normal walk, and then a perfect balance. And you know, by the end of my 14 weeks, I was able to run at a fast pace. and I wasn't even holding on to the bars. My balance sessions became easy to do, and get this, even with my eyes shut. You might be wondering, well, how did this change my day-to-day life? I could play with my grandchildren again. I went to a concert with my husband and my son for the first, and it was a very emotional day for me. All in all, life has connected for me again. I feel like that new person. I'm once again be able to be that doer that I once was, and I could be there for my friends and my family again. I can go out to restaurants, and I'm gardening again, and I'm driving again. And you know, one of my biggest accomplishments was I was able to travel, even getting on a plane. It wasn't easy to do this treatment plan, but I'll tell you, it is hard work. That first week was extremely exhausting to my whole being. It really is. And 14 weeks of doing these treatment sessions was a long haul. But in comparison to the 5 years of misery, every session for me was a blessing. So I'm going to leave you with this. I often stop and think, what if I had not given PoNS treatment a try and given it my all? Well, every day I'm grateful for the scientists who created the device, the clinic who offer it. And if you're suffering and enduring and just going through life in your new normal due to balance and gait issues from your injury, I've got wonderful news for you. PoNS treatment just may be your opportunity to return to life as you knew it, just like it was for me. So thanks again for having me. And if you'd like to reach out to me directly, you can. My email is bafoster82@hotmail.com. And if you just put in the subject line PoNS, so I know what it's pertaining to, then I can answer you back if you've got questions for me. But it's bafoster82@hotmail.com. Thank you, everyone.
Wonderful. Thank you so much, Beth, for sharing your story and offering your information to allow other survivors to connect with you and maybe ask you some more questions. Yeah, it's so important, and yeah, so happy to hear that PoNS was so successful for you. But we do have many questions for you, Dr. Kovelman. So I'll perhaps just read them out to you, and you answer as you can. So one here, how does PoNS treatment fit with vision therapy?
So great question. I'm going to do my best to answer that because I'm not sure we absolutely have the answer. Matter of fact, I'm pretty sure we don't absolutely have the answer. So you have to remember that when we did the SOT scores, was a cumulative score, right? The SOT measures vestibular, oculomotor, and somatosensory. And most of our patients had a composite score. So we weren't able to break down and give you an answer to say, oh my goodness, when we looked at the breakdown of 165 patients that were treated, it seemed that it had more of an effect on their vestibular system than it did anything else. When they entered the study, they had to have a document TBI that had been either documented to have plateaued 1 year since their original injury. Did some of them come in with complaints of just vestibular complaints? Perhaps. Where does it fit in with vestibular treatment? Don't have the answer. Would we be open up to maybe an investigator-initiated trial for somebody to look at that? The answer is we would.
Okay, thank you. And yeah, obviously a complex question, but yeah, thank you. Another question here. This is from an attendee who has mild to moderate symptoms affecting her gait with MS. They write, I walk with a walker now and have no balance at all. Will I benefit? What if I can't do the program twice a day? What if this is too demanding for my current energy level? Can I do it less and still have substantial benefits?
Yeah, so I'm going to go, I'm not trying to skirt the question, I will answer it, but I'm going to go to the IFU, which was mild to moderate symptoms of MS. And that would basically be a decision that is made between the patient, the therapist, and their physician. So I'm going to take a guess here that maybe this young lady's EDSS scores is, 6, maybe 6.5, right? Using the walker, as with all MS patients, they have a tendency to get fatigued, right? You have to remember that in the randomized controlled trial, it's a very rigorous criteria, and that's the only data we have to go on. And most of those patients were EDSS scores of 3 to 6. That doesn't mean when you translate, as I'm sure Ryan could tell us and others, when you translate an RCT into the real world, it usually doesn't happen like that. There's usually a modification of the treatment program to accommodate and set what I would consider to be, and Ryan, please correct me if I'm wrong, realistic expectations for the patient and the program. So if the program has to be modified and you and your treating therapist are willing to look at where you are and say at the end of 4 weeks or 2 weeks, I want to be here. It may not be where they were in the RCT, but that's acceptable to you and your therapist, then I would consider that to be a positive outcome. So I'm doing my best to answer that question, and I hope it did.
Okay, thank you. Yeah, I believe it was a fair answer. And concerning the schedule, I know you did have a slide on this, but maybe some misunderstanding. Do you mind commenting just a little bit further on the schedule? So there was mention of twice a day in the office and for a week, but I believe the timeline is longer than that.
Yeah, so the timeline is, it appears that a lot of the treatment centers are modifying what was done in the RCT, right? Which is to be expected. Depending on your visit and where you are, there are centers diversify in their ability to extend the treatment and to your schedule, right? So I know of some instances where they're coming in once in the morning, 3 days a week, and you're doing all your other sessions in the afternoon at home for 2 weeks. So that means you're coming in 6 times versus for the first 2 weeks. And the next 12 weeks, you're only coming in once, and that's to, do the assessment for your progression. And there are other people who may come in and say, well, listen, I want to do what the RCT is because I want to have that outcome, so sign me up. And that's a decision that's made between you and your treating center and your clinician. Did that clarify it a little more, Ryan?
I believe so, and if it didn't for the individual who asked the question, please let us know in the question and answer, and I will get it to Dr. Kovelman. Going to move on to another question here. Has this been tried on mild traumatic brain injury, concussion patients with persistent postural perceptual dizziness?
EPPD. So I would say that most of the patients that have utilized the PoNS treatment in its early days when they were looking at the device in general and all around balance and gait disorders versus what we're treating now on the label, that there's never been one clear diagnosis that has come into the organization for that. That's my answer.
Okay, sure. And this is another question, very popular one. We did get some emails earlier in the week about this as well, and it's concerning insurance coverage for the treatment.
Yeah, I think that's That's the best question, right, of all of them, because here in the States, it's a little different in reimbursement. So I'm going to give you a crystal clear picture of where it's at currently. So currently, the device, as with any new device or treatment, is not fully recognized nor reimbursed to the best of my knowledge. However, over the last 6 months, we have seen success with some of the payers reimbursing for the treatment program and the device. We actually have developed what we call a dossier, Ryan, which when the clinic submits their treatment plan, it's a clinical summary of all the evidence to send in with your treatment request. That's why you're suggesting the PoNS, that documents everything scientifically, outcome measured, what the current literature is. And most of our clinics today are using that as they send in the treatment plan to seek reimbursement.
Okay, yeah, great tip. Yeah. Okay, there's another question here. Will it work effectively for a person who had a TBI 45 years ago and was unconscious for 6 weeks?
Yeah. So
facing deteriorating walking and mobility issues for the past few years.
So I'm going to refer back to the indication for usage, which was mild or moderate traumatic brain injury with a chronic balance deficit. So off the cuff, it doesn't sound like the original injury was mild or moderate. Okay, that's just an honest answer. However, that doesn't mean where this individual is today. I want to say again that while the indication for usage is what it is, we are a class 2 device, and anybody can walk in and go to any of the clinics that are authorized and say, I want to be treated, right? So that's number 2. Number 3, when we looked at all 165 patients and we did a regression analysis, or we looked back at our data to see all the data inputs we had to determine, is there one contributing factor that will make a determination in them receiving a better outcome? Age, years from injury, SOT score, whatever it was. It didn't matter. It didn't matter if they were 9 months from their a year from their original injury, 10 years from their original injury, 20 years from their original injury. None of that affected the outcome. So the answer is, right now, according to what I know, I can't tell you that whether you're 10 years or 40 years from your original injury, that it makes a difference.
Okay, and I imagine the answer may perhaps be similar here, but I do want to at least position this for you for this participant. So they write that their son sustained a severe anoxic brain injury due to accidental strangulation. After 6 years of stem cell and HBOT treatment, he has regained cognition and can walk with assistance. However, he still needs a wheelchair. Have you tried this on more severe cases? We live in Calgary and are more than willing to try PoNS.
Yeah, so let's get into the realism of what encompasses the treatment, right? So the patient has to be able to put the device on their tongue, and they have to be able to do some sort of balancing gait treatment. On-label, off-label is determination of the person walking the door in conjunction with their physical therapist and treating physician. Is this an ideal candidate? Are they on the label? It doesn't appear to sound like that. However, can this patient go in and bring their child? Can the child put it on their mouth and hold it in there for 20 minutes while doing a balance or a gait? That's really what I would want to know. We're not approved for cognition. That's not on the label. So I just want to make that crystal clear. But you know, that's my answer. Can this patient really be a candidate for the treatment because of the demands of the treatment?
Okay, wonderful. And you actually did answer another question that came through an email earlier this week concerning, yeah, its efficacy on cognition, if there is any evidence. I know you already mentioned it, but if there is any more you could say on that.
Yeah, so remember the primary outcome measure, the outcome that we looked at first, right, was the SOT scores, DGI, and then we had a whole secondary onslaught of outcome measures we looked at. The Headache Disability Index, the Colibri, cognition in general. And if you think about this for a minute, you know, while we saw what we did in the DGI and the SOT, there were improvements in all the other related tests, okay? I can't say they were statistically significant because we didn't look at it that far, but just think about this for a minute. Most of these people who have mild and or moderate TBI with a CV, with a chronic balance deficit, they come in, and I think Beth would raise their hand and say, yes, that was me. They come in and they say, oh my God, I have this cloud over my head. It just, I just can't think straight. And in speaking to patients, one of their quotes is, well, my balance got better. My balance is getting better. My gait improved. But Dr. Kovelman, I got to tell you, it appears that fog has lifted, you know? And we know in the literature, there are publications that when you improve your balance or gait, you will improve your cognition. And does that make sense? Well, if I'm walking better and I'm not falling down and I'm back in society, is my thought process going to be better? Is the dorsolateral prefrontal cortex, higher education, higher executive functions, or is it going to be clearer? It probably will be, but it's not something I can say, oh my God, if you use the PoNS, your cognition's going to get better.
Right, right. And a couple of questions that have come in for you, Beth. I do know that you've already offered your email, and I believe before we began the presentation, you mentioned you prefer to field questions through email. Am I correct? Beth, is it preferable for you if we have questions for you come through your email?
Am I still on?
You are. Yeah.
Oh, okay. You can still hear me. Okay.
Yeah.
I've been just off and listening here. Yes, you can have questions through my email, but I can answer some right now if you want.
Well, it's up to you. I can maybe just ask you again to share your email for anyone who does want to send a question your way. Do you mind just giving us a reminder?
B.A. Foster 82@hotmail.com. And please put PoNS for subjects so that I know that it's an okay site to open up. And as for that whole fog thing, it is gone. Like, yes, everything else does improve. When I had no idea the walk, the balance, all of that lifted helped with everything else. I didn't realize that till I got into it. So it is,
Wonderful.
It is amazing, yes.
Again, thank you for making yourself available to answer questions.
No problem.
Yeah.
My honor.
I believe, are we running short on time here, Dr. Kovelman? Do you have a few more minutes?
I do, for you all, absolutely.
Wonderful. So a question did come in concerning success stories with MS. I have visited your website. I wonder if there is something you could point anyone curious about a success story in MS toward on the website, if there's a video or maybe something you could share with us now. Oh, we may have lost connection. Stand by. Oh, we got you back. Hey there.
Can you hear me?
I can, yes.
Okay. So there is one scientific published study in the MS community of 20 patients, and it was EDSS scores of 3 to 6, right, with associated gait and balance. And actually, it was a 14-week treatment. One group got a PoNS plus the therapy, which we're discussing today, and the other group got a placebo PoNS plus the therapy, thereby saying The only difference in the two groups was the device, which, as Ryan knows, is a really well documented way to do a study, right? Because then you can't contribute the placebo effects to what's going on. So to make a long story short, on average, the PoNS plus the active PoNS plus PT group gained about 8 points on their DGI, and the PT plus placebo group gained about 3.5 points on their DGI. So that not only is statistically significant, but it's a meaningful clinical difference. Now, I realize it, as Ryan will tell you, it's a pilot. It's only 10 and 10, but it actually verifies or leads one to think that the contribution of the device, the symbiotic relationship of the device plus the PT, leads to the outcome. And then we've collected data, Ryan, on about 57 patients to date in our metric system that are pretty much mimicking what we saw in our RCT.
Wonderful. Okay. I wonder if you have time for maybe one last question, or
Yeah.
Okay.
No, good.
Great. So some of the acronyms here you might have to help me with, Dr. Kovelman. I'm unfamiliar.
Harry, please call me Harry.
Harry.
Yeah.
What experience have you had treating motor neuron diseases? I have PLS originally, diagnosed as HSP. I use a walker and my gait is spastic and balance is poor.
So the only publications or experience that I personally am aware of in the literature, besides multiple sclerosis, CP, cerebral palsy, cerebellar ataxia, stroke, acoustic neuroma, and perhaps one or two, I don't believe I have any experience, nor anybody that I know of has treated anybody with that motor neuron disease.
Okay. Just taking a look at the last few here. So yeah, there was a questions about Parkinson's.
Parkinson's, there's been quite a few patients, if I remember correctly, that are being treated. Again, all these progressive diseases, you know, there's not a lot out there.
Okay. There is one last question here. It's a bit lengthy, so forgive me. I'll have to speak at length here. So it reads: I assume this hasn't been studied, but could PoNS theoretically help with adjusting proprioception and perception after vision restoration? I had eye surgery because I'd regained vision after brain injury. Just gonna skip along here a little bit. I became unable to navigate my visual system. Again, to take back the visual cortex and relearn perception and proprioception. So yeah, maybe I'll just rewind here to the original piece here. Yeah.
So here's my 2 cents on that one. That's way out there. That's like, go where no man's ever gone before, right?
Sure.
So if you look into the literature today, there's a lot of evidence that when you combine a therapeutic activity or a stimulus with some sort of stimulation, that it leads to a positive outcome. And the University of South Carolina is doing some great studies with newborns in those that are failing to progress because they're not taking the bottle. And it ends up that they need a feeding tube. And what they did at USC, this is a long-winded answer, but it's going to get to the point. What they did at USC in these newborns was they did a transvagal neurostim on their ear, okay? And when they introduced the bottle, they stimulated the vagal nerve, and they looked at 12 babies. 7 of the 12 that got it never needed the feeding tube, right? The stimulus versus the target activity. The 5 that didn't move forward were all born to mothers with diabetes. I just want to point out. So here's the thought. If you believe that this approach of a targeted stimulus with a stimulus with a targeted therapy is working, then it could be, as this individual said, that if you stimulate, right, with an activity that's in the visual learning, and I don't know them, I'm not the expert, but could that lead to a positive outcome? Perhaps it could. I would have never thought that by stimulating, you know, the branch of the vagal nerve in your earlobe with the suckling reflex to get the babies to move to the next level. So I think maybe, but I don't know.
Okay, fair enough. It does look like that is just about it for the questions. Thank you, everyone, for asking these questions. They were wonderful, and thank you, Harry, for answering them. They were great answers. I'm going to give it maybe just a minute if there is anyone who did want to get one last one in. I do know Harry has to be off. He's a busy man. Yeah, but as we wait, thank you again, Beth and Harry. This was a brilliant presentation. Thank you so much for sharing your experience, Beth, and yeah, your wealth of knowledge, Harry. This was great.
Welcome.
Thank you so much to PoNS and Helios Canada for supporting us and yeah, and just providing a bit more information about this incredible device.
Whatever helps.
Yeah, whatever you need, just don't be afraid to holler.
Okay. Yeah, and for anyone who might have further questions, feel free to email me directly, and I can perhaps pass it along and get an answer back for you. So my email is connections@bist.ca, and you can find that on the website as well. Oh, I think we may have had one more question come in.
Okay.
Wondering if we can see an actual treatment. I wonder if maybe there's something available on the website or...
There is. I think if you log on to the websites, I know Emma is on as well. I believe they have the mechanism of action, and they also have some testimonials and some pictures of people receiving the treatment.
Okay, wonderful. And for those asking, I know I keep referencing their incredible website. When we post a video, I will post a link to that as well, so you don't have to go searching for it. That does look like, oh, maybe one last question.
Yeah.
Okay. This is available for viewing later. It should be on our YouTube and website, perhaps later today, if not tomorrow. So yeah, bear with us, but we will get it to you. Thank you again, Beth and Harry. I really had such a great time talking to both of you and learning about PoNS.
You're very welcome.
No worries. You're very welcome. Thank you so much.
Great. Thank you, everyone, and the rest of your day.
Thank you. You too. Bye.
Bye.